It's 5:02 p.m. on May 11th, 2026. I'm calling to order the Health and Human Development Committee meeting. Welcome to all. Um, uh, as I have in the past, when I was taking the role of the chairman of the Finance Committee, I have the opportunity always to make a comment. And my comment today is in 2 weeks, we are going to be celebrating on the 25th of May, Memorial Day. Let us all remember to honor our U.S. military personnel who died in service. Let us take a couple of moments on Memorial Day to remember that. Okay, next up, I'd like to get into some introductions. We have new committee members here, old committee members here, new board members here, old board members here. I'll start it with myself. I'm Don Trottier, serving as the chairman this year. I represent the 12th district of Mount Pleasant, and this is my 5th term. I'd like to start to my left with Supervisor Miller.
Thank you, Mr. Chairman. I'm Bob Miller. I represent District 11, which is also in the village of Mount Pleasant, basically the southeast part, except not Lake Park. And I just started my 19th term on the county board.
Good afternoon, Supervisor Coleman. I represent District 1, and I'm actually in my 2nd term.
Oh, hi, my name is Tria. This is my 2nd year on the Health and Human Development Committee as a youth and governance representative.
Hi everyone, my name is Ignacio. I've been in the Youth and Governance program for two years now, or this is my 2nd term. I served on the Economic Development Committee, and this year I'll serve on the Health and Human Development. Nice to meet you guys.
Good afternoon. I'm Hope Otto. I'm the Human Services Director. You're going to learn a lot more about my department and me shortly. But I will just say I've been with the county for 17 years, which feels hard to believe, and 12 years as a department head in this role. And I work for the county executive who's sitting right over there. Sorry, Ralph. Say hi. And with him, yes.
I am Kim Bartel, and I am Hope's Assistant for Human Services. I've been there 18 years now.
18. Good evening. I am Andrew Neighbor. I'm new to this, so I'm just learning.
Gabrielle Hood, and I'm new to this as well. I'm the new citizen member.
Hi, excuse me. Hi, I'm Brenda Dankolovich, and this is my 2nd term on the Health and Human Services Board.
Good evening, Scott Meyer, representing the 16th District, Union Grove in Yorkville, and this will be my 11th year on the county board.
Hi, I'm Supervisor Kelly. I represent District 2, which is West Racine. This is actually my 3rd term serving on the board, and this is my 2nd time on Health and Human Services.
Well, welcome to all, and thank you for being here this evening. Next up on my agenda is the Youth and Governance Statement. Who is going to read that tonight?
Hello, we are members of the Racine County Youth and Governance Program, and we will be participating in tonight's meeting. This program serves to empower youth in Racine County by encouraging us to participate in local government. We have agreed to abide by the applicable standards of conduct that would govern any elected county board member. While we are encouraged to participate and are allowed to have a non-binding advisory vote on matters before the committee, all formal action taken by this committee will be based solely on the binding votes made by County Board Supervisors. Thank you.
Thank you. Okay, public comments. Public comments. Third time, public comments. Seeing none, I'll move on to item number 4. I'm requesting approval of the minutes from April 13th, 2026, joint meeting of the Health and Human Development Committee and Human Services Board. Do I hear a motion? I have a motion from Supervisor Coleman for the committee. I need a second from the committee.
I will second.
We have a first and a second from the committee. I'd like any objections, any discussions on those minutes from the committee? Hearing none, all in favor, say aye. Youth and governance, how do you feel about that? Okay, thank you. Then I'd like to take a roll. I need approval from the Human Services Board. I need a motion, please.
Motion to approve.
I have a first. I need a second from the board. I have a first and a second from the board. All in favor?
Aye.
Any nays? Hearing none, the minutes are approved for both the Health and Human Service Development Committee and the Health and Human Services Board. Thank you. Okay, consultation number 5. Notice in accordance with Section 20 of the Indian Gaming Regulatory Act for the Menominee Indian Tribe of Wisconsin, Kenosha 2023 Gaming Project for the United States Department of Interior. This is for information only. Is somebody going to talk about that? Do we have anybody here? There was a handout that was part of the packet. Okay. I'm not the source to answer any questions on that.
And I would say it's only like very adjacently related to health and human services, this topic. So, I mean, I don't really even have any experts I would speak to this from my area. So
Okay.
I think it just by default came to the committee.
Okay, so if there's any questions, issues on this, please bring them to me and I'll find the right individual that can address those. Okay. Thank you. Next up, we had the Human Service Department Program Overview and Strategic Priorities. Director Otto.
Thank you, Mr. Chairman. So typically, for many of you who have already been part of this board and committee, we tend to go more of a mile deep into individual topics at each of our meetings, so you can learn a little bit more about how each division within the department runs. But given we have several new board members and welcoming back some members that haven't been on for a little bit, I thought it would be helpful to just give a baseline overview of the department and an overview of that. And also, I heard Vice Chairman Miller also talking about the statutory regulations regarding the board and the committees. So I would explain that to you guys as well. And at any point, there is an acronym sheet. I'm going to do my darndest to not use a lot of acronyms, but again, after you've been in the industry for a while, you tend to start speaking the speak. So I'll try very hard to not do that. But in your packet here, there is a human services acronym sheet that's almost a little over 3 pages. So in alphabetical order. So hopefully that helps a little bit. So to start off with, the difference between the board and committee. So both Andy and Gabby talked about being new members, and you are part of the Human Services Board. And there are overlaps of individuals that are supervisors on the board, as well as citizen members. Your responsibility is to work with me and the county board supervisors to help provide your expertise within the community to help inform our budget and to help set like community priorities. So as you learn more about what our department does, we can engage in conversations about that. And then ultimately, there's a public hearing in July where also citizen input comes into play into what our budget will eventually be set for the county executive. And then there's also the Human Services Committee, the Health and Human Development Committee, and that is set by ordinance, a county ordinance. The board is set by state statute. So We work in concert with one another because there's two different regulatory authorities there, and we help to develop really the budget collectively as a team. And that's how we've been working for as long as I can remember with the county. And I think that's been your experience as well, Vice Chairman, correct? Yes. So I will start off with just an overview of the Human Services Department, and I appreciate the opportunity to go over this with you. For some of you, it might be a little repetitive, but I always feel like as you're going through things, we remember things that we may have not realized was in the wide scope of services that Human Services provides. So this really is beyond one single area. Like when you try to explain, I often say like I'm the human services director, and people look at me blankly of either is that HR and what does that all entail? And then when you do, you think, oh my goodness, that's a lot of different things. But the goal is really to support individuals that are in need. That may not have access to services that are provided by the private sector. And we are that safety net, we are that resource, and we are that uh, entity to relieve the pressure valve that a lot of people are feeling when there's nowhere else to go. We support children and families, older adults, people with disabilities, individuals who are abused and neglected, whether adults or children, people needing workforce or economic support, really at any spectrum within an individual's life where they may not have resources available to them through their traditional support systems. That's where we come in. But how we do that is a little bit up to the discretion of the board and the county executive and the department head. But that we do it is not optional. These are all state mandates with very few exceptions there. And they're put into that statute for us to be able to assure that people that are in need have allocated resources to them. The vast majority of funding comes from the state of Wisconsin or a pass-through through the federal government down to the state and then to the counties. We are one of, I believe, 8 county administered systems in the country for health and human services. The others typically operate under regional models in counties, but are state operated. So we're unique. But I think that there's a lot of strengths that come with that, because if you're operating locally, you know the community in which you reside. You are the local taxpayers that are voting for, your representatives, and I just think that there's probably a closer to the work by having a county-run system, and the National Counties Association, WCA, agrees with us. So moving on to the mission and vision. We worked very hard at establishing what is the purpose of the continuum of services that we provide. We start from prenatal in our public health department. Public health support is, when children are not yet born, all the way through the medical examiner. And so medical examiners, our version of individuals who would be deceased and needing somebody to declare them deceased outside of a hospital setting, but they're also responsible for relaying that to their family members, and sometimes in very vulnerable situations, such as suicide or overdose. And so that continuum still really makes sense underneath our spectrum of human services, but what are we doing to support people? And our team spent around 3 weeks or so, not straight, but developing what is our core mission, irrespective of where you are entering into the human services system. What are we trying to do? And we decided collectively it was to really build resilience. And for who? It's for individuals and families. And our vision is to create thriving individuals and families. And this dovetails beautifully into the county executive's mission for the county and vision as well, which is the broader community and building strength of the community. And we view our role as how we're supporting individuals and families in that piece of it. The other part, and members that are also on the public health board, were able to go through the process of defining your values, which again feels like it would be an easy process, but really trying to think of what makes Racine County unique and what makes us in the work we're doing specific to our leadership, specific to our community, and to the communities we're serving. And we came up with these 5 items of responsiveness. And I think that that's another way of saying this, and that's aligned with the executive, is the customer service. And one of the things that is the most important to me is if I'm in need of something, if something is as small as like being able to access somebody about my phone bill, all the way to if I'm in a crisis and I need mental health support, I don't want to have to wait to get clarity on what that is. And I think we've all entered in different pieces in our life where we feel that frustration. And that's extremely important to me, that we are responsive to you as the board and the committee, as well as to our constituents. Also connection. I mean, this is the essence of the work we do as people in social services. We want a sense of belonging and community, and we want to feel a connection to those that we work with. And the definitions I'll add in here had to also be created authentically from us. So this is not, the dictionary definition. This is what it meant to us. So dedication, relentlessly pursuing growth, and dedicated, no matter how tough the challenge is, that we're dedicated to the work. And the last 2 are my personal favorites because I think they're what makes us stand out a little. It's just the importance of kindness and conveying empathy and compassion when people are often experiencing one of the worst days of their life when they work with us. We want to be able to communicate that empathy and kindness and compassion with them. And no matter how frustrated individuals are with us, we don't match that energy. We help to understand and empathize where they're at. And lastly, boldness. We have to look at bold and innovative and creative ways to do things. Resources are limited, and we need to take calculated risks because that's what our community and our constituents deserve. Next slide. This is somewhat helpful depiction of our organizational chart. We tried to find a way that was showing the different administrative authorities, and then also the subdivisions that are underneath that. So I have 5 division administrators: youth and family, workforce and supportive services, public health, aging and disability services, and youth rehabilitative services. The largest area is the Aging and Disability Services, and this name doesn't really encompass all of the work that is done out of this area. If you called it behavioral health, it wouldn't include the aging and disabilities, so this is the best and the closest we have to it. There's probably 250 employees in this area. The Aging and Disability Resource Center, we have the manager sitting right here, Amy O'Brien, and she'll introduce herself later in the agenda. But that is serving as one of our only non-mandated services, but I would call it incredibly essential and critical to the spectrum of services we provide. And they work so closely with a lot of different areas. And they're that one-stop shop for anybody who has a concern about a disability or an aging family member, caretaker support, meal support in a variety of different needs that individuals have. And the Behavioral Health Services Division is mental health and substance abuse support. And a lot of details of that I'll get into later. Economic and our workforce and supportive services include our public assistance, as well as workforce development. That area also is a non-mandated area, but we have probably only about 3 or 4 employees in this place. And I think it's one of the areas that make us unique because we support the kind of tail end of all the other support services by knowing employment is an important piece in long-term self-sufficiency and sustainability. So I personally think it's a critical add-in to that. Veterans also, because public assistance and veterans assistance work so closely together, that's under that area. And lastly, the Youth and Family Division. Oh, I have one more up there. The Youth and Family Division that includes Child Protective Services, as well as foster care and youth justice. The Youth Rehabilitative Services is our youth justice area where we house individual youth that have a correctional placement because of a crime that they had committed, and we provide intensive treatment and rehabilitative supports. All right, moving on. So in all of these things that we're doing, we have all those different cogs in the wheel, right? How do we set strategic goals, knowing that although there's separate, directives set by the state and federal government for each area, how do we pull that all together to serve the community in a way that makes sense? And our strategic goals that we came up with are really about building and connecting with the community. And how can the community trust us more? Because we're not always entering into people's lives at a time that they want us. In particular, like Child Protective Services, most people don't. Oh, geez, sorry, my phone just answered on my watch. We're entering in a time in their life where they don't want us there. But if we have built ongoing communication, have worked with them in a preventative fashion, hopefully over time that our reputation will help to know that we're there to support and not to penalize. Also, just again, with the limited resources that everybody has, how do we work better together? And how do we work across divisions? Because often an individual that's experienced a crisis isn't for one particular area. There might be multiple areas in a person's life that they're experiencing a challenge. And back to the responsiveness section and making support easier to access. We know that when you're in a tough period in your life, that you do not want to have to navigate complex systems to be able to get the help you need. So how do we make it easier? How do we meet people where they're at? How do we have technology to support us in our venture? And how do we just simplify the process between all the different areas? And that's harder than you think when you have almost 400 employees with a very specific mission that each area is set with. But we're taking very deliberate efforts to be able to break down those barriers to do that. Next slide. As I said earlier, and I won't get into too much detail because this is the mile wide, not mile deep presentation. The Youth and Family Division is supporting children, teens, and families through early childhood, and then moving on all the way to the youth justice system, which typically happens after about 11 or 12 years old. If kids are experiencing challenges before that, it is considered more of a child protective issue. Later, it's typically involved in the youth justice system, but the overlap is significant. The kids that are served in the CPS, there's to shorten it for you, are 80% are overlapped into the youth justice program. So the more that we are helping kids earlier on and providing that support, the less likely that we are to see youth end up in the justice programs. We have a variety of different things in order to do that again, we'll talk about more as time goes on. Just a highlight and a shout out to one of our kind of key initiatives that ties together the workforce piece as well as youth justice and just overall child development is our summer youth employment program. And no doubt we will be having a tailored presentation on that as we're already kicking off with enrollments in that. Next slide. Workforce and supportive services area. This is my division of origin. So economic support is our public assistance arm. So Badger Care, child care, Medicaid, programs like family care that you've heard of that help provide medical assistance, food share, and all the basic need services. We do eligibility determinations and issue the actual benefits. There's also a robust QC and fraud division in that area. The goal is to also connect to long-term sustainability like workforce development and any other programs within the area. Next slide. Public health came into the county in, 2022 or 3. Help. I think it's 22 as well. Yeah, because it was right after the pandemic, we started the efforts at bringing in the Central Racine Health Department into the county's umbrella, which if you look around the state, there's, I think, only 2 other communities that do not operate a full county-wide public health system, and Milwaukee being one of them, which makes sense. We still have 2 within Racine County. The city operates its independent clinic and health division, and we have the balance of the county. But what we do here is a wide variety of services, including disease tracking and surveillance through like epidemiologists. They do environmental health. There's vaccine options. That's a little bit less at this point, but obviously during a national emergency and or any shortages or challenges within the primary healthcare system, that's really where public health steps in. And we do a home visiting program, both for high risk families, as well as a universal program for all parents who have a live birth in the county. That a visit is offered. So those are the things that kind of support the full continuum of supports within the rest of human services, all the way through, as I mentioned, the medical examiner, which fits, initially you might think oddly, but it actually fits really well within public health, because public health does facilitate the death review teams for the entire county, including the city, including overdose fatality review team and child death review team. And our public health officer is very innovative in looking at ways that we might be able to expand the death review teams, because we learn a lot from those. We learn a lot from near misses, but we also learn a lot, unfortunately, from the actual fatalities of how we can do a better job in a prevention base. Next slide. Talked already a little bit about the aging and disability services, getting in a little bit more specific of what we do in the county. And we have a new building going up across the street from the 1717 Taylor Avenue in Supervisor Kelly's district, that we will offer not only mental health crisis stabilization through overnight care in our program called SAIL, but we will be expanding to do that for a residential for substance abuse treatment as well. And a little preview for the state of the county tomorrow. There is no other substance abuse residential treatment facility within a 40-mile radius to be able to help individuals step down from an inpatient setting or a higher level need of somebody that is in the community to be able to have that sober living environment and support to stay in recovery. And aging and disability resources, Meals on Wheels, which we'll talk about coming up in the agenda. And one of the things that's really starting to draw attention for us is dementia and caregiver support. As we know, the aging population is set to increase by 40% over like a 10 or 15-year period. We know that there's going to be more and more needs for support for dementia and caregiver support that right now is not really met, again, in the private sector. And so that's where we step in. Next. So another area that makes our area a little unique is that we have a statutory obligation to take care of youth who have committed crime and their placement in a secure setting if the judge orders that. And how counties are delivering on that mandate is really up to them. And our county for the past, well, at least 30 years has chose to run at the time a juvenile detention center. And there has been a lot of an evolution about how youth do best in rehabilitating and not recidivating, which is another way of saying coming back into the system and committing a new crime, and gearing on more towards education, therapeutic interventions, being able to address some of the underlying mental health and substance abuse challenges, and helping with that job connection is proven to be so much more successful. And so that's why we have chosen to build a youth rehabilitative and care center that is out on 3 Mile Road. And we are officially, I think, 1 year and some change and some bumps along the way. But I think everybody involved to say that was one of the best decisions that our county has made for our community and youth. So we're very proud of that program and service that we offer. So I talked a little bit about what's next. We're always looking at new ways to deliver on services. And given, again, the goal of being able to be more accessible, more responsive, and meeting people where they are at in the community, being able to relocate our behavioral health services that are currently located on Dominic Drive, which is probably about 1.5 miles away, down a road that's not walkable, and a building that we are paying a decent amount of rent for, that is not really giving us our return on investment, to say the least. And so we were fortunate to be able to have this opportunity to build on the campus where our current human services building is, to be able to bring all of those treatment modules into one space, easier to access on a bus route within the community. Again, the services that we provide out of there are mandated services. It's just, again, how we choose to do it versus contracting out for the services. We provide them in-house and run our own clinic. We run our own case management programs. A lot of the things that are typically done in an outside fashion, we do. Wellness Connect, we've presented on that a few times, but that is a way to try to have mental health access, irrespective, again, of how somebody's accessing services. We have all of the different acronyms, and the C's on this list represent a lot of the behavioral health area: comprehensive community services, community support program. We don't want people to have to try to figure that out. You just need to show up when you have a need and we'll direct you. And that's the goal behind this. And we're integrating in our youth and family supports with the behavioral health. Next slide. I've already said all this, so I don't need to repeat it. It's about us working together. And I will be singing that song over and over again. It's just, we need to come together as one team to support through all the various stages of life to build a stronger community. And it's not just within, our department. It's working closely with law enforcement and with corporation counsel and the district attorney and the judges and the schools and all of our various partners, because it's not one work in isolation. It's really all of us coming together to improve our community. Okay.
Thank you, Director Otto. Take a breath, take something to drink.
Oh, I'm good.
Are you good?
Yeah.
Okay. Let's open up. Any questions from the committee? I'll call on first, or comments. Any questions from the board or comments? Wonderful. Great presentation.
Thank you.
Thank you very much. I like this piece. In fact, I'm going to request if we could forward this piece onto the county board. So, we have 2 new county board members, one that's returning and a brand new one, that it will offer them insight. And then the current county board members, it'll increase their knowledge on what's going on in health and human development.
Yeah.
So if that could be done. Supervisor Miller.
Thank you. Mr. Chairman, when you first asked for committee comments, you just said questions, but so then you gave them the opportunity for comments. So I'm going to jump back to a comment and just thank Director Otto and really say how proud I am, and I think both the committee and the board from past history is proud of the teamwork and the collaboration, which has made our department a beacon, not only around the state, but also around the nation for how to do human services in the best way possible.
Thank you.
Chairman.
Supervisor Meyer.
Thank you. Just a follow up too to Supervisor Miller. Some of us that have been involved in this committee for a long period of time has seen the work that Director Otter and her department has done, along with the other department heads or their other supervisors that are in that area. And we've seen firsthand how they can put some of those pieces together and put the right people in the right place and to provide those services that our residents need. I think this handout just kind of sums it up in a brief way, but there's still so much more that Director Auditor will probably talk about and go on in regards to the services that we provide and the positive outcomes that it has had in the community. So just continue to keep up the good work, and I'm sure all of us will be here to support you as we continue to move forward this year. Thank you.
Thank you.
You want to comment again?
Yeah.
Okay, so do I.
Well, I can't resist because there has been some discussion recently about is human services spending enough money? And I have taken it upon myself to point out that one of the reasons that our budgets are so effective is because of the emphasis on prevention. And prevention saves a ton of money. Because some of the services that are needed, if you don't have prevention, are quite costly. So I think that's another trademark of our Human Services Department that is something to be very proud of.
Thank you, Vice Chairman. My comment, and we can continue to comment if anybody has any. As the Vice Chair just said, it's a prevention that is very important. And one of my favorite programs, two of them are Birth to Three and the home visiting for the new parents. Talk about at the beginning, getting the newborns service, somebody offering to go at the home on the Birth to Three, I believe that's it, correct? Is that the Birth to Three, the one?
Birth to Three is a screening program for babies for developmental milestones.
Okay.
And it feeds also into, here's the CLTS, or Children's Long-Term Support Services. But again, back to early identification, and a lot of, particularly like with autism, if you are able to identify issues early on, you can help to support the development of a child with autism and to be more prepared for school and have less interventions later on. So no matter what the challenges, if you have any concerns, and I know personally a ton of people, personal friends that have used the program, and has helped really greatly with just understanding as a new parent too, what is normal, what is not normal, and how does that then fit into the overall support for children entering into school. So I mentioned earlier, it's not just us, like we're part of such a bigger thing. And we have to remind ourselves that with success and failures, that it's not solely on us, but we're a huge contributor to the success of that.
Thank you.
Yeah.
Any last comments? Okay, I'll move on. We have next up, we have the Greater Wisconsin Agency on Aging Resources Grant, and this is for information only. We have Amy. Is Amy? Thank you.
Yeah, and I know
And
we've
Meals
talked.
on Wheels. You're going to do both, right?
Yeah, we've
Okay.
talked a lot about this already, but I just asked Amy to come and talk from her direct experience if there was any specific questions, because I know that there were a lot of concerns, as there should be, regarding Meals on Wheels and the funding and lack thereof from the national perspective down to us. So we did receive a $100,000 grant, and so we are currently in a situation where we're feeling good. But we don't know exactly what that'll mean for us because we're early on in the year. So,
And the 20 from United Way.
20 from United Way.
So thanks to both. Amy.
Real quick updates.
Yeah. Could you tip that mic down a little?
Yeah.
Yeah. Yeah. Or why don't you do over here at RCDC? Oh, they can call.
That one's on. All right. With the updates that Hope just provided with the 2 grants that you guys are aware of, the good news is we did stop the delay. for the new individuals coming in, Meals on Wheels, several weeks ago, maybe even a month ago. So we're back to business as usual that it was prior to this year, which is still a prioritization model. We've been doing that model for a couple of years. That's what works best for the program. So we do have a meeting later this week with our fiscal department. Hopefully we can narrow in on how much more of a shortfall, if there is one, that we're in, and see what other grants we can target to fill that.
Amy, could you just explain briefly the process? I mean, you were talking about we're back to normal.
Mhm.
What does that mean?
Sure.
Okay,
So if someone would call today wanting to get connected with Meals on Wheels, what would happen is our team would start you at 3 days per week in the meals rotation, and then they would get out within the next 2 weeks to assess you. And we do a person-centered assessment that looks at, you know, what your diagnoses are, your financial means, your nutrition risk, you know, do you have any supports? And all of that goes into the assessment. We get a score. And then from that score, it determines whether or not you need 5 days a week of meals if you're a very high risk, whether you need 1 day a week, whether you don't qualify at all. And then we base your meals on that.
thank you. One more question.
Mhm.
Do you need volunteers to drive?
We always need.
Okay, so
volunteers, yes.
those in the room, spread the word that if you know individuals out there that may be interested in serving on the Meals and Wheels volunteer basis, get a hold of Amy.
Absolutely.
Questions from the committee? Supervisor Miller.
And just to follow up, Amy, if you could describe what being a volunteer briefly entails.
Would entail, sure. So our Meals on Wheels volunteer drivers can volunteer for as little as 1 day a week, which is usually about a 2-hour commitment. You pick the meals up from our Dominic location right now, and then you get an assigned route. You can stay on the same route for your day that you deliver, or multiple days. You know, we have some people that drive every day. We have some people that just drive once a week. We have some businesses that volunteer with us as well. We have some couples that volunteer, which is nice, friends. So it can be as little as 1 day or all week. Also, we look for volunteers in our congregate meal sites. Our new My Meal, My Way restaurant congregate meal site at Angry Brothers is extremely busy. So we're looking for volunteers there to help check people. And we have like up to 100 people each time. So it's really a great site. Mhm.
Thank you. Any questions from the committee or comments?
How often is the congregate site? At Angry Brothers, we serve 2 days per week. And then at Bruno's on the West End is our other restaurant model, is also 2 days per week. And I can't tell you exactly what days those are off the top of my head. And then we serve 5 days a week at the Burlington Senior Center, Salvation Army, and then 3 days a week at Mount Pleasant Manor.
Amy, thank you very much for the update on both. Supervisor Miller?
Yep. I may have heard this, but when we are no longer at Dominic, where are the meals going to come from?
TBD to some extent, but right now we are set up for the 4th floor. There's a commercial kitchen, as you know, up there. So there is temporary space. And then once we decide as collectively what the long-term plan will be for that space, but there is temporary.
Great. Thank you very much for presenting. Next up, we have our director, Hope Otto, doing an update on the opioid and overdose.
So the last 2 items were standing agenda items that former Chairman Miller had asked to keep as a routine item on here. And I think it is still definitely relevant to keep these on, as they're still pressing concerns. And we have opioid settlement dollars. So just having an understanding of what's going on and have that highlighted. If there are any other things that you feel that arise, that's something that we could do as a standing item. Otherwise, we would typically rotate amongst the divisions so that you can get to know and learn more about what's going on in those respective areas, as I mentioned earlier. So in terms of the opioid handout, there's one side that has behavioral health services, and the other side has public health, and they both are helping to support overdose response and prevention. Our behavioral health division does Narcan distribution and training. And on here, we just show how many test strips we have and the lockbox and trainings that we've done. In the recent memos, there was some concerns about whether or not we would be able to still have test strips as an allowable expense, because there was federal funding that was going to be eliminated for that. But the state has allocated opioid dollars to be able to support that. So we will see no change here, just in case if anybody saw news regarding that. So we have no concerns at this time. And then on the vending machine, so we have Narcan that is actually in vending machines throughout the community. We have the highest utilized vending machines, more so even than the city, but we do have the city's numbers on here because we want to make sure that the whole community is represented, even though we're not administering those. And then you're able to see what's being done at those locations. And so there's really not a huge change in here in terms of utilization. We're still seeing that the DMV site is typically one of the highest utilized locations, and xylazine test strips are increasing.
Thank you for the update. Comments, questions? Could you slide the mic over to him? I know you got your hands full over there. Just a day. You got to hit the button on your right.
Just because I'm very naive to all of this is, what is a test strip? What are you testing? I'm curious. I have no idea.
You're actually testing for that drug that is most likely to cause an overdose in fatal overdose. So those are the two different drugs.
So is it for the parents then
That would be a common person to pick up the test strips, or it could be a loved one. It could be educator, case managers, friends,
Really?
and it could be a user as well, somebody who's actually using.
Right, it's just mind blowing.
Yeah, no, good. Good
No,
question.
it's a great
question. Great
All right,
question.
thank you.
You bet. You bet. Okay, is there any other correspondence in business? Oh, I'm sorry, Renee. Excuse me.
Thank you. I think I was on the committee when this item originally was put on here back in, I think, early 24. You guys had done a presentation. I think maybe Jeff had come and done a presentation. So would that be something with the newer people and, that he could come and do another? It was just very informative. I know some people had some questions.
Absolutely. We could, there's a couple things we could do. We could talk about prior to the county board getting the full presentation on the opioid task force. We could do that. We could also just have Jeff and Yelena come and talk about the work that they're doing specifically. And I think the timing would just be a little if you wanted for the next meeting prior to the public hearing, we could do that, or whatever topic you think. That was actually going to be my correspondence and other business item. What do you want to hear from us?
Whatever works best for you guys. Yeah. Thank you.
You will. Great suggestion. Thank you, Supervisor. Supervisor Meyer.
Chairman, one other thing that we might be able to introduce with that new information that is on the QR codes and the vending machines, we could talk to Jeff and see how the new information is being tracked from the vending machines, as far as originally it was from zip code areas. And then now they're talking about, they have more and more questions on there. So if people are willing to give the information, so they're trying to track the data and stuff too, to find out some of those things exactly, if it's for you or a loved one or for a family member. So that helps kind of track that information too. So we can, at our next public health meeting, we could talk with Jeff and see if we could extrapolate some of that information out for that next report and stuff
And then
too.
we'll get it
if
here.
that'd be
Great idea.
And we'll get it here.
What's that?
Just a thought.
And we'll get it. here.
Yeah,
Yeah.
yeah.
To this committee
Yep,
Sure.
just a thought.
and board.
If you like, that could be our next topic.
Yeah. Let's do that.
Okay.
Let's do that. Supervisor Miller?
Thank you, Mr. Chairman. I know we made reference at least a couple times to the Human Services acronym sheet, but I think, Mr. Chairman, might be a good idea to share this with the county board as well. And then if we could circle back to agenda item 5 just for a second. So the Department of Interior is basically asking us if we have any comments on the proposed casino by the Menominee tribe in Kenosha. And of course, one of the possible effects of a casino would be gambling addiction, which certainly would be addressed by our Human Services Department. So if anyone wishes to make a comment, I note that this letter was received March 25th. So by May 25th, they would accept and appreciate any comments.
Thank you, Supervisor Miller, in regards to that potential of the casino. I do have concern about the gambling issue and the counseling for the gambling. I also have a concern making sure that we're providing services above and beyond for individuals out there with families that it's Kenosha County, but it could spill into Racine County big time. But providing family services for the effects of addiction to gambling and safety. I'm wondering what is being stepped up in both counties for safety purposes with the gambling and the alcohol and things like that. So yeah, I will voice my opinion. Thank you.
Maybe a helpful agenda item related to that would be, at the last meeting, we had asked about Dr. Galvez coming and doing a presentation, who's our addictionologist. And he said yes, but he's looking at the various dates. I sent everything except for the public hearing date. So I don't know if gambling addiction would be something he would cover. I would guess so. He's pretty thorough. So I could certainly bring up that topic with him.
That'd be great. That'd be great. Good. Okay. We're good. Any correspondence? Or other business? Hearing none, the next meeting date is June 8th, 2026. Thank you all for being here this evening. I need a motion to adjourn. Great. We have a first and a second. We are